when we eat matters and not only what we eat. So timings matter. So for example, it's always said that the food that you should take at any age, as you get older, of course, maybe smaller countries, but the heaviest is not necessarily the breakfast, which we always used to think. Breakfast has to be healthy, but the lunch is what should be the heaviest. Learning a new skill is very, very important. Whether it's language, whether it's maybe gardening. Gardening is very, if you see the data and research, gardening is very much high as far as cognitive preservation, and people who are older, if they continue to garden, it's very important. Like I'll give an example of when we do cognitive testing. A person who's actually got memory loss will try to answer the questions, but will not be able to. But a person who actually might be depressed is not even trying to hear your questions. So it will be a negative.
Hello and welcome to the Ivory Podcast. Today, our guest is Dr. Prem Narasimhan, a geriatric medicine and elderly care specialist physician who practices out of Mumbai's renowned Jaslok Hospital. We met Dr. Prem at a dementia awareness workshop where his passion for cognitive health and elderly care is what inspired us to invite him to speak with us. Dr. Prem also actively speaks at multiple lectures and webinars where he emphasizes the need for continuous and holistic care for the elderly. Dr. Prem, welcome to the Ivory Podcast. It's a pleasure to have you with us.
Yeah, it's my pleasure to be here. Thank you.
I would like to begin by asking you about how did you get interested or attracted to geriatric medicine as a field? Was there a trigger to it? What was your journey towards it?
Of course, as any sort of grandchild, I was always close to my grandparents. Maybe that just provided me a bit of sensibility, but I would say I didn't choose geriatrics. Geriatrics chose me, and it was just something which was sort of meant to happen, and that's how my journey began. And I would say that it has been a sort of a pleasure and a great sort of experience. Why? Because I have learned more. So because whenever I see older people, they have seen more life. Whether it's positive experiences, whether it's negative, financial, personal, community. So all those things, they are no longer stories for me. They're actually learnings. And it gives me great pleasure that I'm able to do that on a daily basis. And there is a great sense of, you can say, satisfaction as well, because we are able to take care of old people at all stages. When they are fit, when they are unfit, when they're at the maybe at the end of their life. So, I've always been asked that death is a very predominant part of my sort of practice. But I feel in enabling them to die peacefully is where I also come in. So there's a great deal of satisfaction. And then it also has made me realize that relationships with caregivers, and it's when you're connected to an older person, you're not only connected to them, you get connected to their family. So that is what really makes me passionate about taking care of old people.
Got it. And if we talk about, the patients who come and see you, what is their relative age group? Do you get more people in their 70s or 80s? And has that mix changed over the last, let's say, a decade since you started practicing? Tell us a little bit about that.
So I will say that the age dynamics in India has always been maybe overall quite regional. So if I start from where I did my MD, which was in Amrita in Kochi, Kerala, as you know, is obviously always been higher on the age barrier, where people live long, especially females live longer than males, which is the general trend. But there it was like that. But my sort of, I can say, myth was busted when I went to AIIMS in New Delhi after that. So it was pretty much same in the north as well. So it was a phenomenon which was throughout India. Then, of course, I came to Bombay and I started the department at Jaslok. So there was a distinct, obviously, change in the age group, whereas you can say even the life sort of expectancy has increased in India. So as we categorize them into young, old, middle old and old, so that is 60 to 64, then 65 to 74 and more than 75. So I would say we are pushing the envelope. I have seen more and more people who are above 80, more and more people above 90. I've seen a couple of centenarians as well. So it has been pushed, and I think we have to be, which also gives us sort of a caution that we have to be prepared, because more and more people are older and you will need more people to care for them. And it's not only geriatricians, it's an entire ecosystem of people, which would be both healthcare and non-healthcare providers, because that's where we are going to. So it's something we need to prepare for, rather than that just coming as a tsunami, which we would not be able to handle.
Yeah, that's very well articulated. At the dementia workshop where we met Doctor, I saw that you were so passionate about the subject of cognitive health and taking better care of your memory as you age. What attracted you to dementia in specific?
So again, I think as a doctor, you always look up to people in your life. So when you're during your sort of training, so I've been trained with people who are always very much interested in this. And secondly, I feel that I have seen a lot of dementia patients, and the fact that even if you and me have to imagine that we get up one day and it happens daily, and then we actually forget what's happening. And the fact of the matter is that we are not realizing much, but the caregivers are. So when we are taking care of patients with dementia, again, you're not only taking care of them, you're taking care of the caregivers as well. And you're taking care of a whole other things which might seem very trivial to maybe other sort of specialists, but they are a bigger picture. So for example, dementia can be very much a taboo subject as well, wherein a lot of people, especially the caregivers, will be in denial. So you get a chance to actually educate them, not only at that point, but be with them in their journey. And when a person with dementia is taken care by somebody, they actually become advisors to other people who are with dementia. So that's where support groups come in, wherein a lot of people have taken sort of from their personal journey, have taken initiative that although they maybe at that time didn't know much and they learned through it, but that doesn't mean that they don't want to educate others. So basically, I think the most important thing is you're not only taking care of the dementia person, but the caregiver as well. And they obviously need that education, and they provide that education to others, which could be in the form of maybe support groups or maybe even their own personal journeys, and which helps others. I mean, a lot of people don't realize that, but it does. And I think one of the biggest things is to busting the myths that not all dementias is actually irreversible. Because when the dreaded D is talked about, people only come with Alzheimer's, or they just talk that, oh my God, it's the end of story, whereas they might have just forgotten maybe once or twice, or they might just have some vitamin deficiencies which can be corrected. So I think that's why dementia is very close to me, because you cannot lose those percentages of reversible causes just because you feel that the biggest dementia that we talk about is the dreaded Alzheimer's. I think that's...
Let's talk a little bit more about that, because like you said, it is a myth that needs to be busted. There are stages at which dementia can be reversed. There are studies which say that, there are modifiable risk factors which you can act upon. So in your experience, what has been your learnings as a physician working closely with patients almost on a day-to-day basis on cases where you have seen reversal take place, not comfortably, but reasonably, right? So if you can talk a little bit about that.
I would say if dementia is set in, especially the irreversible types, reversal usually does not happen a lot, but what we focus on is preserving. For example, if there is a plateau, that we are happy with it. If there is no deterioration, we are happy with it. So our biggest goal in geriatrics, whether it's a patient with dementia or non-dementia, is quality of life. So a person who is actually forgetting, maybe having problem with language, problem with speech, other sort of sections of the brain also sort of affected, but their quality of life seems to be okay. I am actually happy with it. So a lot of patients, older adults with these kind of qualities, we are at least trying to preserve them. So now this preservation usually doesn't only happen with medications. So most medications unfortunately are for the mild to moderate stage. For the severe dementia stage, I mean, it's almost that you have lost maybe time, and the ship might have sailed. And usually people progress into it. It's not that everybody comes to us only when the last stage of dementia is. And it's only a cliche that, which is talked in movies, that you should have come earlier, which actually doctors never say, to be very frank. Yeah. So I think what is important is the non-pharmacological intervention as well, which I am actually sort of advocating a lot, because I work with a lot of people who provide them. So usually things like art therapy, music therapy, then even that mandala art, which is sort of so people who have had no art in their lives are actually doing well. So these counseling sessions, companionship for people with dementia is actually very much workable. But what we need to understand is start it both at the same time. When you start pharmacological treatment, you start the non-pharmacological as well. Why? Because you need to, as I say, you need to always put cover all the posts rather than just see, okay, let's start the medications. So I think when we do that, it obviously helps in a greater way.
And I think it's interesting you mentioned that, doctors don't say that, it's too late for come because, what is a patient's fault in it, right? You've just come at the stage at which you detected there was some condition. However, there is also a movement lately which says that, you should actually get tested or screened for dementia. And you spoke a lot about it, in your seminar at Dementia India Alliance workshop. Tell us your experience with that and how is it helpful for somebody in their 50s and 60s today or even 40s to be tested or screened for dementia? What will it do and why is it important?
I think that's one of the very important things, to just wait and see that, okay, I might get or might not get cognitive issues is not the right way of looking at it. We need to try to preserve your memory and we need to try to make sure that your brain health is sort of taken care of. So now how do you do it? Of course, there are things that you do to make sure that your memory is preserved, which we can obviously come to. But there is also a very important thing which is there, that is screening. So just being afraid that if we go to a doctor or if we screen ourselves, whether it's anywhere, whether it's an online platform, offline platform, doctors, psychologists, you cannot be scared that, oh my God, if they discover something, then what? If they do discover, it's good. Most people are worried that something would come out of the screening for cognitive issues. So I would say don't screen yourself just to feel that you might have dementia. Screen yourself to know where your brain is at. And that will only help you to maybe get it better. I mean, let us be very frank. The brain gets bored. You can't keep doing the same mundane things. I don't mean any offense by saying mundane. So for example, you work, the brain is used to it. You're doing your work, but that's not giving brain a challenge. You have to do things which actually give your brain a challenge, which could be various things. Acquiring a new skill. And it's a misnomer that you can only acquire a skill when you're young. You can actually acquire a skill when you're older as well. So more and more people should actually get themselves screened just to make sure everything's okay. And it can be very much an yearly screening. Or it could be when you maybe go to a geriatrician, physician, whoever you go to, just try to maybe decide the amount. You might already have risk factors. So for example, if you have a thyroid issue, it is a reversible cause of cognitive impairment. So if you're already on treatment or you need to have treatment and that is discovered, then why not? See, the thing with approaching any healthcare professional is that you should not have a fear of discovery of disease. You should actually have the confidence to make sure that you're preserving your health. So I think both, if you see it more in the positive way, then you're obviously able to preserve your health. And one keeps thinking that you might be healthy, but a lot of times you discover some things. So don't be afraid of discovery. Be looking forward to preservation, and that can only happen if you take that step. So I would encourage everybody to get their cognitive testing done. Again, I mean, there are a lot of sort of facets to it. So for example, the type of cognitive testing, what scales are being used, these are all very important. The literacy of the person matters. So for example, if a person has not seen a clock in their life, there is no point doing a clock. So it's very important that we understand as healthcare professionals, and people also understand that do not get intimidated by the test. It is just a free-willing talk with that professional, and they will be able to obviously help you later, at least by giving you tips to maybe preserve your brain health, rather than just thinking everything is about maybe plus minus a medication, or you just have to think that this is where it is going. It is not to put a notion in your mind, okay, now I'm going downhill from now. It's not. It is for you to take steps preventive. And we are in a day and age where we are into prevention more. So we should not be worried only about treating dementia. We should be worried about knowing more about it and then ultimately make sure we don't get it and spread the word that other people obviously don't get it. And yes, if and when you actually have cognitive issues, so be it. We obviously tackle with it whenever it happens.
So doctor, on that note, just to close the loop on it, let's say somebody has, discovered that there are cognitive issues. You said that, there are certain things that you could do. Could you elaborate a little bit more about certain things that you have seen actively work in patients positively from a, let's say, a preservation point of view for memory care?
So I think one of the very important things that is there is you have to take care of your physical health. There is no doubt about it. You can't say that, I can eat everything. I will not exercise. and then my lifestyle is going to be fully sort of busy, and then I will still not get memory issues. So I think one of the very important things is lifestyle. I think sleeping is very important. It's not the quantity of sleep, it's the quality as you age. But anywhere to this date, 6 to 8 hours is actually important. And hardly, at least the younger generation is not sleeping, even if they have the time, because we are more onto blue screens in the night and binge watching rather than actually looking at things which would just put us to sleep. And then a lot of times when we eat matters, and not only what we eat. So timings matter. So for example, it's always said that the food that you should take at any age, I mean, as you get older, of course, maybe smaller countries, but the heaviest is not necessarily the breakfast, which we always used to think. Breakfast has to be healthy, but the lunch is what should be the heaviest in a way, not necessarily in oil and all. Why? Because that is going to pull you till evening. Because because why? The lunch is what makes your day. And why? Because you are in very active mode. So the breakdown will happen well. If you have heavy dinner, then everything, I mean, yes, our digestive system works in the night, but metabolism is slower in sleep as compared to maybe in the day. So that is a misnomer that people think. Of course, most people have realized that dinner, they shouldn't take this. And if you see certain sort of, you can say sects of India, people already always don't eat something after sunset. And it works. And it sort of works for them. So I think that is good. And I think after of course the diet part, what is important is giving the brain a challenge. And I mean, it's just a trajectory. I don't know whether it's happened with you or maybe people you know. We always have hobbies, but we tend to keep killing it. Or the hobby continues when it becomes your job. So for example, if you are a writer, then you are a writer. But that doesn't mean that's your hobby. That becomes your job. But if your passion is analysis of cricket, so that is your passion. So that would actually make you push yourself more. So learning a new skill is very, very important. Whether it's language, whether it's maybe gardening. Gardening is if you see the data and research, gardening is very much high as far as cognitive preservation. And people who are older, if they continue to garden, it's very important. Why? Because it involves a lot of nurturing. If you see the smaller parts, you plant something, you have to water it, you add manure, you take care of it day in, day out, and then you see the results. Yeah. So for example, a lot of people are getting into organic farming. Yes, not only necessary because of this, but also because of all the pesticides. But what's happening is that's also nurturing and self. So if you see a lot of people who actually have been born and brought up in farms, especially abroad, they actually are living a pretty good life. Purely because they've always been physically fit, they have been cognitively fit, they have been doing all these things. Then learning a new hobby also is good. So for example, learning an instrument. Then yes, people have said Sudoku, puzzles is good. It is good, but if people have this, you can say always aversion to do it, that's not going to be helpful. So the brain wants something which is challenging, but at the same time, you should be doing something which is not necessarily irritating. Which is what I tell older people, because what will happen is then you'll defeat the purpose of doing things. I know a lot of old people who actually, they have sort of adapted. They were very good at carom, then they adapted to playing Ludo online, on the iPad. And then they were playing puzzles also, maybe even 2 to 3 years before their death. So interest should never be killed according to me, but at the same time, make sure you try to do something different. So even after retirement, again, I am not a very big fan of retirement per se, purely because I don't think anybody actually retires. It's just something which the government has said, because private organizations, nobody really retires. You just maybe stop working or you try to do something else. So I would say you should try to do something else and always be prepared. So another way of preserving memory is, and so that you don't have issues after retirement, is to plan out your life post-retirement, that what exactly you want to do. Don't think that you are going to have a lot of time. Because you will have time, but suddenly you will realize that you don't know what to do with that time. So that will also help. Planning will also help in your sort of memory being based. Then very simple things. As I'm sure as a child you would have done the same. We always used to write things down. We don't anymore. Yeah. Because even, I mean, you might have a sort of a note kind of, maybe a notepad or a note kind of phone. I mean, everything has developed, but it's not equivalent to writing, because the technology is still helping you out. But if you write things down, you are actually doing a lot of things. You are remembering, you are writing it down, and then that is consolidating. So keep writing. So to-do list should not be only once in the phone. The phone should be helpful. You have technology to remind you. For example, pill reminders are something which are very much in, and they're good. But that should be an addition thing to you already writing. There have been people who I know who had the entire contact book here with pages. Okay, you go to this page and then the number will come down and this is the number. But we are in the day of age like I and you. I'm sure if we lose our contact list in the phone, we are done.
We're done. Absolutely.
And we will be thinking about, oh my God, have I backed it up? So that's what would be the worry. And not that, oh, I have a copy which is hardbound.
Yeah.
So I think that is where we are. So all these things are something which a lot of old people used to do. So these are all advantages. But the younger generation, are we doing the right things? It is very much a debate for us to even talk about, maybe sometime other time, but ultimately we have to understand that where we are going as an aging population.
Right.
I mean, the next generation of agers.
I want to actually touch upon that before we come to, other aspects of, aging. But just to touch upon that, like you rightly said, like our parents, for example, Dr. Prem, would probably write it and, they would remember like, yellow pages, they would not have to go back to again, once they go a number. Do you think the fact that today's generation of 30s and 40s are not writing things as much as they used to do earlier, is that affecting the brain in some manner? Is there research which says that we could be at, let's say, at greater risk, or is just a matter of evolution and the brain will adapt? Like, where is your...
So, since you said adaptability, that's the beauty. I'm sure that the older people who are writing can do technology too now.
Yes.
So they have adapted. So that obviously gives me hope that we will also be able to adapt. So, for example, things like AI, they are supposed to be helpful. They are not supposed to replace. Till they are not replacing things, I am actually okay with it. The reason I am saying is ultimately a human element is always going to be there as far as elder care is concerned. 100%. Anything else is fine, but elder care, it's a lot of compassion, touch. That's why when you talk online, if you say online to offline, I think seeing a older person in person would always be better. But as far as the younger generation, I think that they will adapt to. But what is the fear is, we are actually cutting down on a lot of things which we used to do very normally. Right. Like it was very normal for a lot of my age group people to go to play every day. I mean, it was just it's like an autopilot in your brain that 5 to 7 khelna. If it rains also, you're going to be in the rain, get wet, and your mom will be telling you just go directly and take bath. But that used to happen. Now it has been replaced with everything online. How many children are actually motivated to go out and play rather than just putting up maybe the AI technology gaming console? That is one of the biggest reasons that everybody likes to game. I mean, when I used to, but I got out of it because I started seeing that it is replacing our time, which ultimately, it is augmented reality. It is not reality. And it has come up a lot, but it will give you the feel. But going out, perspiring, burning calories is much different as compared. So that something is, future generations have to see that they actually take care of themselves. At the same time, have this. I think anything in moderation is good, but whether they are going to continue to not sleep, continue to just keep doing things apart from that, is their goal of life going to be trying to preserve themselves and longevity, or is it going to be just live the moment for whatever time they are? I mean, I'm not very sure that people now actually think very long. People of the past generations used to think what they would be after they retire. I mean, that was the sort of planning. But now, even if you see, it's all about getting what you get and maybe even spending everything. Not necessarily looking at the fact, I'm not even saying financially, time also. You have 24 hours, just spend it. Rather than actually seeing that what you want to do maybe 1 month later, or where you want to be. I mean, these are all questions which are always asked by all youngsters, when they get into corporate jobs and everything. But how many people are actually trying to work towards that is something which, I mean, it's questionable. And of course, I mean, the jury is out. I mean, I cannot comment, to be very frank. But we have to make sure that if it was 100 years ago or 200 years later also, the most common denomination will be health. If you are healthy, you will be able to do everything. If you are not healthy, you will be able to do things, but you will burn out at some point. And our body has been created in a very perfect way. It will not drop out until and unless the body has not put the entire power to defend ourselves. But if we keep pushing the limits, the body will break down at some point, and then that is when we have these extended holidays where we are not able to work. So I keep telling people, and older people also, that your 60s, you still need to keep working yourself because you are going to live till your 90s, 100s. So it's no longer the time that 60 you are going reverse counting and all. That is not even, no older person even talks like this anymore. Yeah. In fact, they keep telling that the 60s are the new 40s. I am not a fan of that. The 60s are 60s, but you are aging better. You don't need to put a number to the fact that no, I am 30. No. It's about not getting to the fountain of youth or reversing yourself, but it is about being 90, but being healthy and being and aging gracefully. So that number game completely goes out and you are the age what you are, rather than just saying that you are a 90-year-old who has maybe no issues.
Got it. And, that's a good segue for us into, to go into some of your, deeper clinical work wherein you work with so many patients. One interesting thing that we are realizing is that whenever we, let's say, speak about cognitive health to a particular customer, they always tell us about multiple conditions that they are facing. Some of them could be chronic, some of them could be non-communicable. Now, you probably have the vantage point of being, having access to everything that the person is going through. So, and again, these are complex cases, right? So, how do you manage that for someone who's in their 70s, 80s? Like, how do you ensure that, whatever you are prescribing is not at odds with, some of the other chronic conditions that are specializing? Would love to know about your practice.
So the beauty about elder care is that you cannot be very narrow-minded. So basically what happens is that it's not only one condition that an older person will have. And for example, you might say brain health, cognition is important, but there will be a lot of issues which can actually worsen the symptoms. For example, it could be diabetes, hypertension, stroke, heart disease. So these are all vascular risk factors, which obviously sort of worsen things. But at the same time, we have to see where other things, like for example, if there is any fall risk, if there is depression. The reason I'm saying is depression is one of the common differentials of actually even cognitive issues. Because a lot of people might be depressed. Like I'll give an example of when we do cognitive testing. A person who's actually got memory loss will try to answer the questions, but will not be able to. But a person who actually might be depressed is not even trying to hear your questions. So it will be a negative. So it will come on the scale as maybe he's having cognitive issues. But when you try to do some depression scales, it just hits the jackpot and you're like, oh my God, it's actually depression. Again, easy to miss, very easy to treat. I mean, depression is very much treatable, modifiable, reversible. And to say that older people do not get depressed is not true. But at the same time, it's not a myth that all older people are. I mean, I'm trying to put it out very clearly because that is a notion which is always sort of put out that no, they'll be feeling, no, it's not natural. I mean, people get depressed because of multiple conditions, because of multiple issues. So that is a very, very important thing. So when you put all these things and on top of that, unfortunately, no rule that you cannot get multiple conditions and on top of that you get dementia or cognitive issues, then it starts looking a bit more muddy. But as a geriatrician, I always try to focus on every issue because you treat every issue at different times, giving priority to the most important issue, and you will be able to handle the complex conditions. So what is important is we have to look at interactions, that which diseases we need to keep at control and which diseases we can obviously maybe reverse, and at the same time which conditions which we can tackle. So for example, there could be social issues which is leading to depression. there have been people who have cognitive issues with depression. That becomes more difficult because they are forgetting, they are having brain health issues, but at the same time, they are not sharing anything because they have sort of become literally inward and they don't want to talk because they are obviously depressed. So I would say that relatives and caregivers, caretakers are the ones who have to be really, really careful in noticing these changes, because just branding it on aging and saying that no, just watch, maybe thoda TV dekh lijiye. A lot of times when you observe that, then a lot of relatives or caregivers realize, no, actually this was something now, maybe he's not comprehending well. Then things like vision, hearing, I mean, these are things which are very much correctable, often neglected. Vision, not as much as hearing, because if you see, everybody is ready to wear specs, but older people are very, very resistant to wear hearing aids. Of course, I think technology has helped, because these days you have things, I mean, even our sort of earpods which we actually hear for music, I mean, you have things which are there. However, it comes at a cost, number one. Number two, we have to make sure that we help them to get adjusted to it and not just say this is available, you need to use. And I think that sometimes we miss the point that technology can be helpful, but you have to convince the person trying to use it rather than convincing only the caregiver. The caregiver is going to purchase it, or the older person might purchase themselves, but ultimately they have to be used and you have to be with them in that journey rather than just thinking in a way prescribed, and that's where our role sort of ends. So it can be complex, but it is not something which cannot be handled, and I'm doing it in a daily basis, but try to make sure that the relative also understands that, because they need to understand that it's not as simple as it seems, but at the same time it can be handled, because it can be very intimidating for them, because a lot of caregivers are even in denial that how can they even have cognitive issues or how this happened, because obviously it comes as a shock.
Got it. And just extending that bit about medications, I think nobody wants to have, so many medications, and it's almost whenever we speak to people, we always feel that, are they having too much medication? So how do you manage the medications or pharmacological kind of routine that a person is set to? Do you advise beyond a point that, probably try non-pharmacological interventions like you mentioned before? Or like, what is your, I would say, yardstick to ensure that this person can probably benefit from more medication and this person, we should reduce medication?
So if I have to answer it in a different way, what is important is pharmacological and non-pharmacological, as I told earlier, for any condition should be happening simultaneously. Why? Because if you have a heart disease, you cannot expect only the blood thinner to help you. You have to obviously adjust your diet, you have to have exercise, maybe you have to reduce your weight. So a lot of lifestyle things, reduce your stress, sleep better. So all those things matter. People have a tendency of thinking that drugs will do the magic. No, only drugs don't do the magic. It's a combination. So pharmacological thing, as far as multiple drugs is concerned, unfortunately most older adults will be on that. But a lot of times older adults are more on supplements rather than on medications that they actually need, essential medications. And sometimes, unfortunately, they even hide it. Purely, if you don't ask for it, you will not know. But they might be on 2 types of calciums, maybe 2 types of vitamins. I mean, there is only a certain amount that will be absorbed. So taking it more is not going to really help. So the easiest way I try to tackle is obviously try to look at the prescription and delete whatever which according to me is not important. Because a lot of times drugs can lead to interactions and then that can lead to bigger. So for example, a common drug side effect of a antihypertensive can cause maybe swelling of the feet. But if you treat the swelling of the feet with another drug, then that can cause side effects rather than just changing that drug or asking if that is bothersome. So small things matter in older people, but they can cause catastrophic events as a cascade. That's why I think drugs, the lesser the better, but that doesn't mean they are not helpful. We have to optimize the number of drugs. The lesser the better for anybody. I mean, let us be in any age, but older people, we have to realize that we are not having drug interactions only. It's drug to drug and drug to aging body. So the kidney is 80 years old if an 80-year-old person is there, and not a 40-year-old when a person is 40. So one has to understand that with age, the changes obviously are occurring in the body, and we have to understand, we need to take care, keep that in mind when treating those patients rather than just seeing. Another very important thing which I would say is older people should refrain from taking over-the-counter drugs. A lot of times people do the shortcut of just not consulting doctors and over-the-counter drugs. And the trend has obviously changed, and even pharmacy people have become more vigilant. They are not providing, but few years ago it was very easy to get almost everything. And another thing is alternative medicine, like homeopathy and Ayurvedic. Again, I have nothing against it. A lot of times older people work well with alternative medicine, in sync with, but do not try to hide it, and be wary of quacks, because it's not the allopathic it's not the allopathic, homeopathic or the Ayurvedic practitioners who are top of the line and have knowledge cause harm. It is the quacks which take advantage of the situation, of the vulnerability of older people, and that's has a problem. So just be open about what you are taking. So at least if I have the knowledge, I can help you. If not, then we can work in sync with the other specialities, so that at least we know that you're getting a holistic care and not necessarily a care which is going to affect you. So a lot of people, when they go to maybe a allopathic practitioner, they were like, what is the use of mentioning? But I'm not like that. I believe in knowing all the drugs. So drugs means everything, from ointments to syrups to maybe even a minor sort of home remedy which you will not actually sort of tell. So I think that is very important as far as drugs are concerned.
I think you mentioned one very interesting point, that not only should the patient question the physician as to why are you giving me this drug, but the physician also should confide in the patient to tell him that, look, tell me everything that you're having so that I can help you better. I think that's the point.
Yeah, and another thing that older people or any person should be, that it's not necessarily that whenever you go to a physician, drugs will be prescribed. Because there is a tendency for that thought. Drugs always help you, but they are going to help you over and above. Yes, of course, life-saving conditions, obviously drugs will be helpful and they will sort of get you out of those situations. But you need to take care of your optimization of health is overall and not only drug dependent. That's why I say that there might be a lot of ways that you can get anti-aging, but most of them are actually changes in your life and not necessarily drugs.
Understood. Doctor, you spoke about planning, towards the end of life. I think you began this podcast saying that, that you can help people decline gracefully, not to use the death word, but would love to know from your experience, what are some of the things that people can do to do their end of life planning better with their caregivers? I'm sure those are very sensitive conversations to have with caregivers. Two parts to that. A, how do you approach it? And B, anything that you have observed that, helps them in their journey.
Yeah, so very important, I think, is now it's very much, I think, legal to have a living will. So you should have one. I mean, everybody should have actually, and older people especially. But always make sure that you have enough for yourself, because when you age, you obviously need that. And secondly, advance directives are not really legal in India yet, but you need to have those conversations with your own kin. For example, when you have a life-threatening situation, do you actually want to get intubated? Or do you want to be put on on a ventilator? Do you want to get put into ICU? So these are certain directives which will help your kin to decide when you cannot of course, this has to be done when you're cognitively absolutely fit and not when you're cognitively declining. But then, of course, obviously it doesn't hold anything as far as legality is concerned. But it's very important that as you plan life, you obviously should plan what will happen maybe after your death, which is in every way. It should not necessarily be financially, but in every way possible. Then end of life care is very much, or palliative care is completely different. So, but palliation should not start only in end of life. Palliation starts from day one of whatever the condition. Another misnomer is palliative care is only for cancer. Absolutely not. There are heart conditions, Parkinsonism, neurological conditions, there are respiratory conditions. So palliation can be done for a lot of other things rather than cancer only. Cancer helps us in spreading the word about palliation because that word comes mostly in that. But there could be a lot of things like comfort care. So I think at the end of life, my very important thing is to make sure that the older person is comfortable. Now, how do you make sure of that? By having good conversations with the relative where these, for example, if we give this, the person is going to be pain relief, but the person might not be in their senses. So we have to see the risk benefit, and most relatives obviously opt for the fact that no, we cannot obviously see our kin in pain. So those conversations should not start suddenly. If those conversations are happening earlier, then people are ready to do. Of course, a lot of times, maybe the older person and the caregiver are not in a state to even discuss that. And they say maybe it's too early or they're not comfortable. So we have to obviously be cognizant of that, and that is fine. But in most people, people are ready to sort of, and I would say a very important thing about old people, that they are not afraid of death. I mean, we feel that they are, but I don't think they are. They are very, very important on how they live before they die. So, I mean, a sudden death is something which they would be like, it's a blessing. Painful, sudden death, maybe death in a sleep, which is quite sort of ideal. But prolonged, bedridden, people actually being caring for them, or you not being in your senses, which can be towards the end, especially in dementia, is not something which is sort of any person's. When we are younger, we are obviously fearful more of death, obviously, but it's not that older people want to die. No, they want to live well. I mean, they want to live till the last day they are in this earth. They want to live well. And I think that should be the motto rather than, so we work together in making sure that that is comfortable, because that, I would say, that is an honor also as a geriatrician, that you might not be there when the person is born, but you're actually helping them when they are leaving this. And I'm sure, I mean, if a gynecologist looks at it in that perspective, they are very happy when they actually give birth, because they actually have helped in getting a new life to sort of this. And I think a lot of way spirituality, all those things also come in. So those conversations are very good with older people. And I think they should be looking at their life whenever they go as something that it was maybe a mixed bag, but I was happy most of the time, or I wasn't. But it shouldn't be a burden on them during the end of life, because ultimately they have done whatever they could have done because of the best of their capabilities. So it should be more on focusing on the positivity and trying to make sure they're more symptom free, rather than trying to maybe cure a disease. It should be more about care.
Got it. And Doctor, as we end towards this podcast, you've given so many messages of optimism and hope. For anybody who is watching this, is in their 50s, 60s, what would be like your top 2 pieces of advice to somebody who is thinking about their 70s and 80s?
So I think I wouldn't say top 2. I think one of the biggest advices, and the only advice I have to do, is the way you are going to age is going to be how you take care of your health. I mean, you can do everything else. Everything is important. Yes, your financial independence is important. Maybe your structural independence. By structure, I mean where you're in society is important. But if you do not take care of your health, all of this goes down. So take care of your health, number 1. And number 2, have more knowledge about aging, because you are going to age, not because you have aged parents, grandparents. Be selfish in trying to take care of your own aging. I think so. This is the biggest sort of, I think, message I can give. And be passionate about aging well, and not necessarily trying to take back your years, because that's not going to be practically possible till we invent a sort of a time machine. Of course, there was a time when in the Bond movies, when Pierce Brosnan was talking on the watch, we were sort of skeptical. We can do that now, so we never know. Yeah.
Thank you so much, Dr. Prem. It was such a pleasure to have you. I think we will have to engage with you even more as we go ahead, because you're such a wealth of knowledge, and your experience and practice in healthy aging could benefit millions of people who could watch this.
Yeah, thank you. Thanks for having me. Thank you.
Thank you.